today we're going to talk about labs. We're going to take a look at some labs. As a matter of fact, these are my labs. And for a very long time, I was faithfully going to one particular healthcare system, and I was faithful with them. But one thing that I learned um, is that they used an algorithm when it came to African Americans versus any other culture. And their reason for that was that African Americans had some hereditary things going on like no other nationality does, right? However, they made African Americans a group, and then there's another, other, everyone else. And so that in itself, as you will see in a little bit, was very biased and very discriminatory. And because what they did with this algorithm is they made African American numbers higher than anyone else's. And so some healthcare systems were very notorious with this. And so you're going to see one that was, in particular, that we're going to concentrate on today, that was very notorious with making African American blood work numbers higher. And there's some things that they pretty much targeted. They targeted areas that had blood work that would produce higher rates for uh, markers for diabetes, for liver disease, and for kidney disease. And those numbers were made higher. And so from that, they would put African Americans on certain medications. And so after a while, been on those medications, well, those things did occur. But you're going to see just how that went. And so that is, you can be mindful about the decisions that you make and to be very proactive in your healthcare, and also when you're viewing your different results. I mean, you need to be able to look at and determine whether what you're seeing is accurate and true. And you got to get very familiar with the hands and the people uh, whose whose your life is in their hands. And so, uh, but to be very honest with you, I've never met or talked to a healthcare professional that didn't have a smile, that didn't say hee hee ha ha. I've never met one that didn't do that. And so you're going to have to get really informed, or at least pay attention. Now, this one that I'm showing you, this one that I was going to for years, I started in June of 2016. That's when, I started being a little bit more health conscious. And the first thing you notice is that this creon level is up. It's kind of high. And so you'd be like, okay, yeah, I'll say something going on with my kidneys, you know. And then you go on down. But that one's, they got it up a little bit. The creatine level is 92. Go on down. Now that was in June. This is now in August of the same year. And you go down, and they're saying there's something wrong with the ALK. But the goblin, now look at how they're targeting the goblin. And we're going to talk about that uh, as far as just what that means. And then you got that low. And so this is August 2016. Now we go on and we get into uh, October 2016. And now they want to go back to the creon level, like something's wrong with my kidneys, right? Down here it reads as my comments, you get real scared. That chronic kidney disease, the stage of the disease, and it goes on like that. And you're like, I'm a little worried about my kidneys, you're going like that. And it's the same system. And then they're targeting that as well, the goblin. Now remember, those two we're going to come back to. We're going to talk about a little bit more as far as what that made an African American person susceptible for in that healthcare system. Because if they went into the hospital, that made them susceptible for almost any kind of experimentation with drugs or with procedures. That, because I don't know whether you all realize this or not, but hospitals are no longer really for the care of people. It is a business. And African Americans make up about 16% of the population. And so they're really primed to be experimented on, because sad to say, and mostly, I mean, it's true, they're not very informed about their care, and they've been taught to trust their healthcare provider, right? So let's go on. This is then we're going down now. I start getting suspect about some things, because uh, now they keep pinpointing certain areas. Uh, we're gonna come back to that. Now, one thing that really piqued my awareness about this is that in June 16th, I took a peptide, and this is supposed to tell you whether you have heart problems and it's being elevated, right? I took that in June 16th, but then I went to another hospital because I thought I was having chest pains, right? And their results for me was much less. Look at that, 27. And I'm like, whoa, there's an issue here that it doesn't, no heart issue is going to deplete in that little amount of time, you know. In June, I had heart issues now, and a few months later, I don't. And so that kind of opened my awareness to the differences in different labs, in different places where you get labs. And so I went to a different person. I mean, I took some of the medications that the people had gave me for that period of time, and then in 2021, I had moved somewhere and I went to another. This was a cardiologist, and he took a bunch of labs, right? And so if you look at these labs right here in January, I mean, everything looks pretty good. It talks about the filtration a little low. Who knows whether that was uh, a false or whatever, but no other number here brings up any concern for that. So, but you can see with the buns and everything, potassium, everything is all right. The creatinine level is pretty good, uh, within limits, right? So this was in January of 2021. Now I decided to go back to the other system, right? I go back to the other system that I've been, and this is like uh, February of that same year. Now, as you can see, from the January 22nd to February the 8th is not that long. That's like a couple weeks. Now, all of a sudden, I got elevated levels again. As a matter of fact, they added one. They added diabetes. Now they want to make me pre-diabetes, and I'm like, and that's what the doctor they're trying to do, make me pre-diabetes. Now you see how in two weeks, not even, yeah, 2 weeks, how these numbers have become real extreme. Now all of a sudden my creatinine had popped up to 1 and we're talking about this is February the 8th. And I'm like, hold up, there's something wrong with this. I'm back at that other system that's using this algorithm. I mean, all my numbers up. Look at this. Look at that. Everything is up, right? And so you sit back and you say, And so what I began to do, this is what I began to do. I began to get my labs printed out from whichever doctor that I had, and I began to go to two different labs and take them within a short period of time of one another to see who was actually giving me the right results. Now, keep in mind that the system I have been going to all this time always had my numbers elevated, right? And so I decided to go to a different one. Now remember, this was February the 8th. About a month later, I went to a different lab. And this is how my labs look. All pretty good, right? All pretty good. All of them, right? And so after that, I went to a different lab. Right. I started going to different labs to see, because labs don't really change that much over a short period of time. They just really don't. And so this other lab I came to, and they gave me an explanation. I finally got an explanation, and this was actually in October. At the bottom of this, it kind of tells you what date it was taken. Okay, this was in October of 2021. Let me go back up to the top. And it kind of tells you what that algorithm, what some algorithm they use. Now, this particular laboratory, they actually used it before, but they, as you can read here, they're stating that African Americans reported as 28% greater than 21% greater than others. Higher, 21% higher. The use of race and kidney function estimating equations is no longer recommended and may result in overestimations. In the near future, an approach that disregards race will be implemented. Well, they should have been doing this all the time. However, this statement was made by this particular laboratory, not the one I have been going through for years, and we're going to come back to them, but had been made in October, right? Okay, these numbers look pretty good. That statement was made in October. However, there is still, we're in 2024 now. There are still hospital systems using that old algorithm. Still, uh, for lack of a better word to say right now, jacking up African American numbers when it comes to these labs. And these labs look pretty good. And I'm gonna let you know, full disclosure, at this point, all that medication that first hospital was giving me, I came off of it by God's grace, By God's grace, I prayed. I said, because I'm gonna tell you that system. They had told me that I had a disease, right? And they said that I needed to take this medication. And they said, well, this medication can quite possibly make you blind. And I said, sir, I'm not taking that because I can't be blind in this world. And that's at that point that made me seek the Lord's face concerning that, because I'm like, Lord, I can't be blind in this world. I just really can't. And so right here, we just looked at October. We're going to go to a different healthcare system that I got some labs at. And as you can see, these labs now are pretty good. And now I'm off all of the medication that they had me on. I'm not on that anymore. The Lord had did pretty good, because I was on a medication, a prednisone, and they had my body on fire. That was also around the same time I said, Lord, you're going to have to help me with this one, because if I'm going to go now. I'm going to go with you. I can't go in pain, and I can't go being tortured. So help me do what I need to do. I also start changing my diet. Now, I can't say it just miraculously happened. I changed my diet as well. Now, we're back to this old one. We're back to February 8th, but I brought you back to February 8th for a reason, because they were trying to make me a diabetic here. And if you look at some of the other A1Cs that I got, they're pretty good. And these are other labs, and I was supposed to take that out, but I didn't, black that out, because I didn't want to show any particular system. You all can ask in the comments which one of these labs gave me the results that I really trust, and trust is the key here. And so, speaking of labs, you also have to be mindful of the kind and what they're saying they represent. And that brings me to the diabetes, because that's one of the things that, even if the hospital does not have that culture anymore and they not support that, that does not mean your nurse or your doctor doesn't. And it does not mean that laboratory doesn't. You know what I'm saying? And so you got to be very mindful of just where you're getting your results from and who's ordering them. I had a doctor, was a new doctor that I had went to see and everything, and she wanted to take, I wanted my vitamins taken, and she wanted to add a diabetes test to it, right? Which is what they do. And we talked about the A1C. We didn't talk about anything else, right? And so, and I did this visit with her over a video, and she was very nice. They're all nice. And be real honest with you, doesn't matter if they're African American or whatever. It doesn't really matter. You need to pay attention to what they're ordering and why. And so, because I asked them to send me my labs so I can, as a PDF in my chart, so I can print them out and take them to whatever lab I want to. I said, attach my stuff. And so, but when I got them, I looked at them and I saw some other things that we didn't talk about. I saw that they had actually ordered some STDs, some hepatitis B, and some shingles and everything, and COVID. And I had already explained to the people about COVID, so I didn't even understand why some of these tests were in here. And for me, there is no reason for them to be taking STDs. That's just a waste of money, or just none of they. You know, if my doctor was paying attention, she knew some of these were not. Uh, uh, they were not necessary. And so some hospitals, some systems and doctors just take tests and stuff, order tests for you so it's billable. And some of them have hospitals, because remember, it's about money. They've made it a standard. And so, no, I don't want those type of things in my records, because I like my records clean. And that's the other thing about that other healthcare system I used to go to that was notorious about the algorithms for African Americans and so forth, and bumping up the numbers. They also bombarded charts. And so if they bombard your chart and you end up in the hospital, you lamb to be a guinea pig for almost anything. And that's just the way it is. And I'm just showing you from my experience that I've looked at a few people's medical records. And at some point, if I feel comfortable with it, I'm gonna relate some stuff that was very serious that they were doing to them. But let's go on with this one. So I tell these people I don't want to do this, and so it turns out that it was not my my doctor, but the nurse. The nurse had took over what me and my doctor had talked about, and decided she was going to add some things to it. Like I said before, there's bias in almost every system, right? And so if it's not your doctor, it might be the nurse, you know. And so you got to be very mindful of that when it comes to your care. And she wants to explain to me why some of these things are recommended, when I've spoken to my doctor about why this is not necessary for me. But yeah, look at the list of stuff my doctor actually had. Now listen, I see that my doctor had it on there. However, the nurse ended up changing it. So the A1C, she actually changed to uh, another. She changed to another um, test. Now, the other test was supposed to, what she said to me, is supposed to be able to go in and determine whether I was a diabetic. But come to find out, if you look at this test, it 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 is used, can be used for that. However, it's not the standard for that. And what makes that particular test uh, just not accurate, or not the one that you should have them diagnosing you to have diabetes on, is because here it is down here, right here, this adipocetine, whatever it is. She said that this right here was supposed to be used to determine whether I was diabetic. And I went and I looked it up. I looked up on it and to see just what it was about. And this particular test right here can determine. It may be able to determine if you have diabetes, but it's also will determine if you have inflammation. And I know I have inflammation, and so this particular test alone by itself would have given me a false positive, and then they would have said I was a diabetic. And so I had to, as you can see, I had to fight for them to give me the standard, give me the A1C test, so I can know if 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 my because I don't want a false positive. I had to go through that with them, and it's pretty sad to say that this nurse had switched up on me and was going to try and take that test to say that I was a diabetic, you know. And we're going to go back, and when we talk about what some of these test results can or may mean, you're going to be a little surprised at some stuff. At any rate, I fought with her on that, and so of course we look right here. And this is my point right here. I had them to reorder that A1C, but I also had them keep that one on there. And so as you can see, this the one that she said they were going to use, yeah, it's going to be high, and I know it's going to be high because it's sensitive to inflammation. It was reading my inflammation. It's not reading whether I'm a diabetic or not. You see? So you got to be mindful of what tests they're using to give you your diagnosis. And so as you can see, I took these two tests at this on the same day. On the same day. Okay? So you got to be very mindful of that. Now, the other thing that I want to do right now is I want to go back up and I want to touch on some of these right here, back to this notorious healthcare system, right? And these numbers, just what they were trying to do. Now we've already went over that. When I went to another laboratory, these numbers became normal because that wasn't what was going on with me, and they were using the algorithm that aggravated these numbers. Now the thing about them diagnosing you with these various things, if they give you medication and you take it for a period of time, it is going to affect you. And so at some point, if you've taken it over extended period of time, this may become true for you. And that's just a sad reality because some of these hospitals are doing different studies and clinical trials and stuff, and they're using people to do it without their knowledge. They really are. And maybe I'll do a segment on clinical trials and to find out if your hospital or whoever you receive your care from is participating, and just what they're participating, what drug or what tool instrument they're participating in for those research trials. And so, because there is a website that can tell you, maybe I'll do a segment on that. However, let's come back here now. Let's look at this, what some of these quite possibly could mean. Now, first of all, let's look at this, not that one yet. Let's look at this level right here. And you can kind of see it's kind of off there. Move this over, but we can see what I want. The ALP is supposed to measure. That's an indicator of several things. Now it can tell you whether you have liver disease, bone disease, kidney disease, or digestive issue. They tried to make it seem as if I had a kidney issue with this, but I already knew I was born with scoliosis, so I knew it was a bone issue. That's why this was high. Okay, and so you got to be very mindful of what they're equating your labs to. Because the other thing is, if they're trying to equate you to one of these other disorders, there should be some other test that they take to go along with that. You know, they really should, just like with the albumin. Now, with the albumin and the goblin, I call it goblin. They said that it was supposed to uh, cancel. It was supposed to. I was having a liver problem, right? But with that, uh, it could also be for my bones as well. If those numbers are just a little bit off, and the albumin, they say that is for to help pass through, um, help your hormones and medicines and all of that pass through. Well, if your levels are low, it can be a reason for a few things, even malnutrition. And that's what happened with one person that I knew, very dear to me. They were severely malnutrition, and they used it to go in and mess with her liver. But it was actually that she was malnutrition. What was the issue with that? Um, this LDH1. Now, with the LDH is an enzyme, and this is just, when it comes to these different labs, we have to know and ask them to pinpoint just what it is that they're trying to say is going on. And so this one right here can actually, that test, just the basic test. Let me bring it down. Just the basic test, just the basic test. Hold on. Up, right here. No, not there. Oh, we gotta go all the way back now. Here it is. Just the basic test um, can be off. And so if we go up a little bit to that notorious healthcare system for pumping up the numbers, you'll see that they had mines pretty high too before. However, I had got them done, but this particular facility, when they did them, they included all of the different variations that it could be. Let's go back to this so I can explain this a little bit more. Right here, when it comes to that, it's found in the cell of almost all your tissue. This is found in. So if it's elevated, if this is low, what they need to do is pinpoint where it is. Okay, whether it is the heart, whether it is the liver, whether it is the red blood cells, the kidneys, or the muscles, or the brain, or the lungs, and each one of these down here tell you. Each one of these numbers or fractions are related to each one of these areas. And so if they just try to pick one out and say, oh, you have kidney problems, oh, you got liver problems, you say, show me the fraction for that. Where is the fraction? I don't see the fraction in any of my labs that tell me that that's what it is, because these are the fractions. Now, as you can see, mine are pretty good, but before that, notorious healthcare system tried to make it seem like something going on with my liver, you know. And so we need these breakdowns right here, you know. We need the breakdowns, and so we need to be very mindful when we're trusting people with our our health, you know, because any medication these people put you on over a period of time, it will be it will start manifesting itself, you know. And so I'm going to show you what my labs look like very recently, the recent labs that I got, you know. And these are the very recent ones. I got these in November. And so nobody's messing with my creatines anymore, my almonds, you know, nobody's messing with stuff anymore. Uh, One more thing I want to point out too. If your white blood cells ever get really low, the only thing that means is that you need to add maybe once a week or so some red meat to your diet, and that'll just bring those numbers right back up. You know, um, that's the other thing too. When it comes to your cholesterol levels, and they want to put you on a statin or whatever, and 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 I'm going to show you with this particular lab, although it says that I have high cholesterol here, and this was taken November 2023. When I went to the other lab, because I remember I've gotten into the habit of going to more than one lab, this was in February. As you can see, my numbers are fine. And also, when it comes to cholesterol, each one of these means something, and it's addressed a different way. So when the people say that you have high cholesterol, say where. And I'm gonna leave it up to you all. Well, hold on 1 minute. Let me do this right quick. Let's take a look at just what the cholesterol levels mean for us, you know, what it means. I mean, this LDL, which is the one that they always say you need to be mindful of, um, um, what is function. It transports cholesterol particles throughout the body. It can accumulate in the walls. However, these cholesterols help your system, so you have some in there anyway. Even some of the bad ones you do in there anyway. It's just that if you have too much of it, they can clog. However, if you exercise a lot, that will offset this ADL that will offset that. Then of course you have good cholesterol, which is broken down in the liver, and then you have this trig. Now they say the most common type is the fat in your body. Now the majority of time when they want to put you on statins and all of that, they use one of these. But to be real honest with you, they need to be looking at all of the numbers before they put you on a statin, because the statin is a medication that's horrific for your muscle skeletal system. It will begin to mess with your muscles. And so you really got to be mindful and ask them, or even take a look at you and be proactive. Say, don't just give me the ADL, give me all of what makes up my cholesterol, so I can see just where the issue is at, and so I can address that issue, you know. Um, and so I just wanted to point that out too when it comes to all of these medications that they wanna give you. Now there was one healthcare system that I went to, and I had got some laughs from them, and I needed to talk it over with the doctor because I didn't trust them. It was telling me something I knew absolutely wasn't true. And what you're going to hear next is a doctor that, without saying it, she actually understands, and she knows that depending on where you get your blood work will determine what you diagnose with, and some of those are not correct. And so when I asked to go to another system for her to write me some orders, she didn't hesitate. She didn't hesitate at all. She just said, well, how you want them? And so you'll hear that for yourself. I thought I'd throw that in because this one was actually longer than what I wanted it to be. But I wanted to add this. But the other ones I'm going to add some more things to it so you can hear what people are saying. But I just thought I'd give you a clip of her. My thing is that I'm questioning the labs. Right, I'm questioning the results. Is it possible to get, listen, I have is it possible to get because I know inflammation, and I know it's in my body. And so is it possible to get a retest of those labs and I get another lab? Use a different lab.
You mean, what do you mean, like a different institution?
All of the labs go through the hospital, or do they go through another lab? Do y'all use the same one?
Yes, so everything goes to Alvern.
It goes through. Okay, yeah.
Alvern, yeah.
Okay, can I use like or something like that?
Oh, you know what? Why don't you go outside and go to if you want?
I don't like. I'll go to no. I'll go to lab.
Okay.
So if you. Yeah, if you can do an order, just attach that order to my chart so I can print it out. You know how they do that?
Yes.
Yeah,
so
do.
It would be two orders. One would be a Cedric, and the second one would be a CRP. Okay? So try to get those done before you come. If you come, that way we have those also.
Yes, ma'am. Yes, ma'am. Definitely. But yes. Yep, we have to start being very mindful of where we get our care from, and also who's doing our labs. We're also going to talk about X-rays and imaging. Oh my goodness, that's going to be a what? Because some of these texts, well, we'll talk about it. All right, always remember to post if you have any questions or any comments. But stay encouraged. Stay encouraged. The best treatment for anything is exercise, and I just have to tell you, to offset the majority of these things is to try to eat right, and that just means some healthy greens. Make sure you get a lot of fluid, a lot of water. Cut out of the sodas, cut them out. Cut down on your sugar. You know, you can have cheat days. I have cheat days. You know, I have those too. You know, um, cut down on the fried food. You know, you can have a cheat day. You know. But try to get some exercise in, even if it's just walking, you know, uh, just walking around the house, walk around the house about 30 times, or walk in place, you know, do some stretches, you know, and that will help you offset because the reality is all of these, you're not supposed to be on a medication for any extended period of time. It's not going to do anything but harm one thing or the other.
What?
Y'all have a good one.